Well, good evening, everybody. So it's been a few days, but get a little prep work done and breaking out an old one. So, those of you who don't remember, this is Dr. Knight. Helps if I press the right button. Quite some time since I've been in GTA 5, but it definitely is. And make sure just so I don't forget. Oh no, my telly went dead.
Taco, please.
Hey, brother, what's going on? I'm Dr. Knight.
You have a deep fucking voice.
Oh, just a little bit. What's going on tonight?
Oh, that is the best RN ever.
I think dick's a little hard, but I need some food, please.
Hey, I don't got any food on me, but see if we can get you feeling better so you can run down to the grocery store at least.
What the?
What? Doc, did you give me something or something?
No, are you
What
seeing?
kind of drugs am I on? What the fuck?
That is definitely a Bigfoot standing there. Alright. Let's see how you're feeling
Wait, you
now.
you saw that too?
I did. You weren't seeing nothing.
Man, I'm in the corner.
Who forgot to go off doctor duty? Is there
No
anyone
one
in here?
puts baby in a corner.
Is there a doctor in here?
Yeah, give me 1 second, brother. Get you up.
Yeah, baby.
I just can't see shit in here.
Ah, don't worry. I'll get you fixed up and get you outside.
Thanks,
Keep
Doc.
talking to me like that, I'm gonna fix you up.
Hey, yo!
Don't get too excited now. Alright, brother,
Hey,
you're good.
yo.
Alright, let's see what we got.
My right hand is painful. I fell off a balcony and tried to catch myself.
Where the
That ain't no good.
oh.
Just need a quick split on here and you'll be good to go. There we are, sir. You are good.
Thank you, sir.
Alright, now let's get you fixed up.
Oh my god. Jane, are you okay?
Actually, he just had a couple minor scrapes and whatnot. You're actually good to go.
Appreciate it. Looking good today, man.
Yeah, be careful. Come see me if you have any trouble.
Yep.
Can I ask one question?
Okay, what's going on? Sorry, I didn't have to chat up. Got a little ambushed with patience there. Was not expecting. Oh, let's see here. Oh, actually, never mind, I forget. County Club Bean Machine. Burger Shot. There's Night.
Hello,
Hey there, is this Burger Shot?
this is Burger Shot. I'm doing deliveries. What can I get you?
Yeah, I'm definitely starving like a fat kid in a dodgeball tournament. I'll take the biggest meal you got.
Okay, that's gonna be 150 when I get there.
Excellent. I'll be right here at Pillbox waiting for you. Just ask for Dr. Knight.
Okay, sounds good.
Thank you, ma'am.
Bye-bye.
Bye-bye. And actually, just so I don't get ambushed by more patients. Actually, which casualty do I have? Oh, I got 430 on me. Even better. Oh, hey, what'd you bring me?
Immediate surgery.
Oh, here, let me go get back in the ER.
Exactly.
Sorry, I'm just
Oh, excuse me, ma'am, sorry.
a little dance. It's kind of cute.
What happened to you, deputy?
I fell off bike unit and got impaled.
Alright, where'd you get impaled at here?
Alright, the arm here. Fucking street light.
He must be getting worse. He didn't sound this bad about 5 minutes ago.
Was it a piece of rebar
His
or?
man turned over. I think he's just trying to lobby for some. Shh, this is therapy, Roscoe. This is therapy. Shh.
Alright, let's take a look here. Alright. Pretty fair impalement here, but check your clavicle. I can't feel today. Alright, does this hurt when I press down? Deputy, you still with me?
Yep, yeah, I am here. What?
Does it hurt when I press down on your clavicle?
It's a little tender, but it's not painful.
Excellent. Well, that's good. You didn't break it.
Oh, that's good. Yeah. I have to remain working.
Alright, you're gonna feel a pretty nasty sting here.
It's alright, I can take it.
Alright, I'll clean this out real good with iodine. gonna be a little
It's
cool here.
MySpace. And you're not in my top 8. Get the fuck out.
Yeah, should have jumped you over to a different bed there.
It's fine. Everyone just wants to share a bed with me.
Hey, thanks. You kept me warm.
You're welcome.
Alright, Deputy, let me get you some stitches in here. Alright, let's get a good running cross stitch in here. That'll keep you tied together, and you just have to be cautious. I wouldn't recommend any long arms for a while.
Oh, that's fine.
It probably wouldn't be the best idea.
What about bicycle unit?
That'd be a lot safer.
Perfect. Lieutenant Dangle's coming out.
I think desk duty writing all the reports for all the arrests would be best.
Oh,
I
I
heard the MDT's down.
I like the Chief's idea there. That sounds the best. Keep these stitches from getting ripped out. Alright.
It's working just fine. The MDT captain got it working.
Fuck. Why is he so good at his job?
Alright, Deputy, you're good to go. Keep them stitches cleaned and covered for me.
Thank you.
And just be easy on that arm. It'll take it a good 7 days or so, but
I will. It's not the arm I use that often. We're good.
excellent. You be careful out there. Come back and see me if you have any trouble.
Will do.
Here you go, doctor. I have your order.
Oh, perfect. Thank you. I'll get you some money here. There you are, man.
Thank you so much. Have a good one.
I appreciate you. Oops. Yeah, still want to hit the other one. Yeah, I need that. I'm gonna go find a damn trash can. Oh, hell, forget I can't. Look at that damn pigeon milk. Can't believe those damn IFACs actually expired now. That kind of sucks. But, hey, you know, everything's got to have an expiration date. Well, damn, I was hoping for a good surgery.
Sorry. He came in saying that he needed immediate surgery.
Yeah, I'm just glad Burger Shot got here about the same time. I was starving.
Yeah.
Yeah, now I've been kind of lazy and hadn't fixed Nightbot, and that's not a good thing I really should fix, so. Yeah, how's y'all's night been?
Oh, it's been good so far.
Yeah. It's kind of steady. How's yours?
One minor impalement so far, and a couple of just general sick patients, but joys of the ER, right?
Yeah, true. You never know what you're gonna get. I mean, some days are you can barely keep up with everything.
That is true. Oh, let's see here. This is very abnormal for Pillbox right now. Oh, this place be hopping like freaking strip club on Saturday night. Tag, y'all are it.
Yeah.
Well, let's see here. We need some more upbeat music because this is going to put my ass to sleep. Try this one. Man, that go postal Dan was flying. This one's probably gonna put me to sleep too. Jeez. Try this one. I don't need sleeping music. Not yet. Well, actually, before I get again on the, go put on that scrub top I used to wear that works with these pants. It's not really a good pair that goes with the new top. Oh, actually. Yeah. It's actually not horrible. It's just quite a bit closer than the other ones. Let's see. So let's do. Not quite exactly a good match, but a lot better than the other one. Man down at the clothing store. Nope. Not my problem. I'm so glad I don't have to work the ambulance. Just wander around the hospital. Actually, while I'm thinking about it, Nightbot, where are you? Pain in my butt. Again. Okay, so I got time. And I'll just $6,500. Sharia. There we go. Drop and go, drop and go. Actually, crap. I think I say Roy's number. Nope, I did not. And heal. 179. Ugh. Yeah, lots of yawning right now. I'm tired. An exhausting day. Let's see what's on old Hate Bird.
602 plus 1, so it'll be 1019 to Pillbox, 137.
I could be nice and answer the radio, but yeah. What the hell? Wow. Hey, brother, I'm Dr. Knight. What happened to you?
You have a stab wound that I got packed in there and applied a pressure bandage.
Oh, let's take a look here.
Okay, we're gonna go grab that next call.
Alrighty. Looks like pretty clean through and through. Get this all put back together here. A couple of stitches in here, we'll be good to go. Alright, brother, there we go. Just be easy on them stitches for me, okay? Come see me if you have any trouble.
He stole my stuff. Going backwards.
Ten four. Oh, that last one, it's old officer actually worked under Shilan when he was Commander SWAT. Howdy.
Nope. We just gotta go back there. Wait, now you gotta put your leash on her.
Not even gonna ask.
There we go.
Alright, you can go ahead and check in.
One of those days we all go.
Definitely started getting a little busy. I've actually got a patient coming in that put on antibiotics a couple of days ago.
Oh, okay.
I'm have to do a conscious sedation on him, but shouldn't take too long if anything major comes in.
Okay. Is it from the one from yesterday?
Yeah, Mr. Scott. I just had to get some antibiotics in him.
Okay. I wasn't really sure if that was like worth a page or just like, you know, tell him to make an appointment.
Oh, it's all good. I was sitting around not doing anything anyway, so.
Okay. Thanks, I
Well,
appreciate
Mr. Knight,
it.
I successfully survived the antibiotic circle.
Ah, that's good. Hopefully your kidneys are still intact.
Yeah, definitely is. Feels weird. But you know, when you're from India, you've been through worse.
Yeah. Well, I'll tell you what, let's head back to my office and I'll get an IV started and I'll give you some happy juice and I'll get in there and drain that out for you.
Sounds good, perfect.
Come on back.
I'm sorry, I walk a little slow. It's no fun, but you know.
It happens to the best of us.
Yeah, they finally accepted my reinstatement. That's fun.
Oh, excellent. How long before you actually start?
That'll be something that you decide depending on my physical fitness.
I mean, realistically, with the conscious sedation, it shouldn't be more than a couple of days. They're gonna put you through some crazy, strenuous activity.
Yeah, alright. I mean, you know, there's a thing that I do when I get recently reinstated to come to terms with all the changes. I just ride along with somebody or be on desk duty.
Oh, yeah, I don't have
peace with things.
I don't have any issue with you doing that. All right. Go ahead and pop that shirt off and just hop up on the bed and get comfortable. You grab your chart here. All right. Have you ever had a conscious sedation before?
Yes.
Excellent. So, definitely not a horrible procedure. It more or less just to keep the pain under control and you not have any bad memories of the procedure. That's about what it amounts to.
So, I mean, hey, in SWAT training, Supreme pulled out a bullet out of me without any sedation whatsoever, so I think I'll be all that.
Ah, yeah, I mean, hell. Shiloh used to pull bullets and knives and you name it out of people, and you just slap some quick clot in it and say, get your ass back out there.
Yep. Yeah, grab a seat on this shirt.
Right. Yeah, everything looks good here. So, let's see about getting started. Alright. Yeah, you want to sit up for it?
Do you want me to sit up?
Nah, I can do it either way. Hell, I've done procedures upside down before.
I'm upside down for you. That's okay. You want me to lie down on the bed? That'll be fun.
Whichever you're more comfortable will be fine. Oop.
I should give you room to work with that.
That'll work just fine. Alright, first thing I'm gonna do here is just clean the area real well. And this iodine will feel a little bit sticky, but I will say the infection looks like it's gone down quite a bit.
Antibiotics, greatest invention known to mankind.
Oh, hell yeah, especially good old Bactrim. Pretty sure if you mixed a little bleach with it, it'd take rust off a car.
I might want to try that sometime. Trust me, I will. I've done dumber shit than them.
Alright. And just a nasty little stick here. Let me get an IV going on you.
A lot of new people in PD. It'll be fun to work with the new ones.
Yeah, hopefully there'll be at least a few that you remember. Hell, I just saw the chief. He came in, one of the deputies just a little bit ago.
I think Roscoe is on duty right now.
Yeah, still
we
can't
can,
get used to him and that damn beard he's got.
Still got it? God.
need
I
to
remember the day he actually used some crazy ass beard oil to actually grow that, and well, it was fun. Certainly awkward, yes.
Alright. I'm gonna give you a little bit of Ativan here. This is just gonna make you relax and just help you enjoy it. It does take it just a minute to get going, but it won't take long. How you feeling now?
Pretty good. I'm honestly, I don't even feel it anymore. Do you still, does Pillbox still do therapeutical services? I remember that there was this huge ass lawsuit for that therapeutical building up near Vinewood.
As far as I know, they still do, but you know, I really hadn't talked to anybody about it since old Fog left.
Fog's still around?
He doesn't work here at the hospital anymore. He quit or got fired or something. He's actually he's out at the pilot school now. He's one of the pilot trainers.
Yeah, I remember. It's got a real history. A lot of these people, they don't even know. It's I remember when I'm
Hey,
sure you
Bear,
do
what's
as
going
well.
on,
It's
bud?
Better and Buck, who first started it with the formation flying and stuff like that. We even had an Independence Day celebration with the formation flying and the fighter jets. And eventually, when Vetter left, there was somebody to manage it. And I had a good friend of mine who was a state employee, Han Solo, who actually took it over, held it together for some time, and then I think Spitfire
602
what was his name?
76 is the latest call.
They arrested him multiple times for landing in places where he was not supposed to land.
Oh, damn.
And yeah, he took it over, and I think it's doing pretty well.
Excellent. Can you feel me touching it?
Yes, I do. It's pretty minor.
Yeah, let's put just a little bit more lidocaine in here. Me pressing on it is one thing, you feeling a scalpel going into you is another. I definitely
There you
don't.
go. I don't feel it anymore. Yeah, there you go. Perfect.
Excellent. Alright, well let me get some clean gloves and a mask on, because it never fails. These things tend to want to explode when you cut into them.
Never?
Shouldn't be too bad as much swelling's gone down, but still want to be precautious. Well, did you have any excitement since I saw you last, other than finding out you're going back to work?
Sorry, what was that?
Any excitement since I last talked to you?
It's complicated. It's I don't know. It's difficult for me to say anything as of this time.
Oh, hell yeah. Yeah, hopefully you'll... Oop.
But it'll be real fun trying to adjust to the new order of things, you know. A lot of people, especially the ones I train, are in command now. It's like all my kids grew up.
Oh, hell yeah. There's a couple of doctors running around here that I taught when they first came in, just snot-nosed EMTs, and hell, now they're full-blown doctors.
Yeah.
It's interesting at times, but you know, I'm still proud of them. Alright, lots of pressure. If you feel any pain, let me know.
Will do. Definitely. I had a discussion with a good friend of mine yesterday. Who's a sergeant now. Used to be my cadet way back. He says that the new batch of PD is really I don't know, like we got hopes and expectations on them.
Nice.
Might be good. No, we'll see.
Alright, I'm gonna put a little pressure on this and see if we can drain it out. Oof. Yep, that is thick and pungent. You still doing all right there?
Yeah. The smell is bad. I can't feel shit, but I can definitely smell it.
Well, I can't help you much on the nose. But as long as you ain't in pain, that's the important thing.
You know, there's an Indian politician who says that pain is a state of mind.
Alright, let's make sure we got everything. Oh! I think I found your bullet.
It should be right there. Hey, I mean, I don't know, man. The bullet has been with me ever since I closed my eyes the last time. It's been with me. It's like a toxic relationship that I have with it.
Hey, I'll tell you
It's
what,
been with me longer than my wife.
Yeah. I'll tell you what, I'll put it in a jar for you.
Might as well make a necklace out of it and wear it on duty.
Yep. That looks like a 9mm.
Would be a 9mm, yes. I'd be really surprised if it wasn't.
Well, it looks to be all intact as well. Damn, you're lucky on that one. Got a little bit of tissue on it, but...
I mean, yeah, this is the result. It was an import operation. They imported it from some foreign country. I'm guessing the craftsmanship should be excellent, which is why the bullet didn't break.
Right, we'll just drop it in there. Alright, well, so let me remove this cyst liner and I can stitch you up and you'll be feeling a hell of a lot better. stubborn here. It's definitely been there a while. Here she comes. And that is it.
You know, I always wear my glasses in surgery. You know, if I gotta go out, I gotta go out in style. So that, say that in the event that I do pass out, and I pass away, people will be like, hey, say what you will about that guy, you may not like him, but you gotta admit, that man's got some style.
Hey, you know what? If it makes you happy, it ain't bothering me.
The last surgery I had was terrible. From the looks of it, there was a glass shard stuck in my neck, almost rupturing my artery. I had to do an arterial bypass as well, somewhere in my body, I don't know where.
Well.
And I don't know, I crashed my car near the fuel station in Sandy Shores. My Toyota Supra, completely obliterated, and the windshield cracked. It was actually surprising that it cracked in the first place, because it was reinforced. But when it did, the glass pieces were pretty much intact, and they were pretty big, and they were stuck to my neck.
Ow.
I don't know, I've just made my peace with it, Mr. Knight. I don't know what to tell you. Every morning I wake up, God takes one look at me, and he thinks to himself, what filter should we use today to make this guy's life more depressing? Accident.
Yeah. We gotta figure out a way to get that look changed.
It's whatever, you make your peace with it.
Yeah, it is what it is. Ain't dropping things, I'm tossing things. It's more fun. All right. And that, sir, is that.
Perfect.
Get all this put away here. All right. Well, gonna sit up and see how it feels.
Let me try.
It's nice and easy.
Yeah.
There we go.
Feels good. Feels good.
Yeah, try moving your arm around a little bit. Let's see how it's moving. Nothing crazy. Any pain or...
Oh, really? I don't know, it's been so long with the bullet, I don't even feel it. Pretty good. Might be an accurate time to evaluate when, I'll let you know if I pick up a class 3 and I feel any discomfort. Or, yeah.
preferably not a class 3, because you're gonna have to see me in the operating room for that one.
That'll be fun. So the bigger question is that, am I good to go back on duty, and can I drive back to PD, or do I have to ask somebody to come and pick me up?
Well, if you can pass my test, I'll let you drive, because I know you got a hell of a tolerance.
Alright.
Alright, state your full name.
It's Michael Scott.
Your date of birth.
should be 1985, 2707. However, it's written 2000 on my ID card for some reason.
Alright, who is the sheriff of Blaine County?
That is a difficult question for me to answer. I haven't gone for 7 months, but the last time I was here is better.
A good answer, because it's still better. What day of the week is it?
For me, it is a Tuesday, but for you, it should be one Monday night.
Excellent. Alright, you see that water cooler over there?
Uh-huh.
Show me you can walk a straight line to that and come back right here to where you're standing. That may not be a law enforcement field sobriety test, but I'd say you're looking pretty good there. So tell you what, those stitches gonna have to stay in for probably 4 or 5 days to be fully sealed up. But I don't have an issue with you going to work as long as you'll stay on the lighter side of things.
Right, that sounds good. That sounds good. I never said no to getting paid to sit in an air-conditioned vehicle and sitting in the back seat judging people while your food is delivered to you.
Yeah, we can definitely work with that. You know, you can drive, you can, do paperwork, things like that. I don't particularly need you out fighting with anybody right now or catching any more bullets.
Alright, sounds good. Sounds good. Perfect.
Alright, I will extend your antibiotics for another 5 days just to be safe. And I will write you a note here for clear for light duty work. So.
Alright, sounds good. Perfect.
And here's the best part. To get those stitches out, you don't have to wait on me. Any of the staff can remove them at the end of the 5 days.
Alright, that sounds wonderful.
So just come in, tell me to get your stitches out, let them read through my notes and look it over. They'll pop them stitches out and they'll let me know if there's any complications, but I don't suspect we'll have any.
Alright, sounds good. Beautiful. You know what? I'm just gonna use this opportunity to call somebody and ask them to come and pick me up because I need someone to drive me around. This is the perfect excuse.
Here you are, sir.
Thank you. Let me see who I can call. It's funny because half the contact list is either dead or missing.
Yeah, well, it happens. Oh, and do make sure to clean those stitches real soft with some easy soap and water at least twice a day for me, okay?
Alright, sounds good. Let's see. It's like a friendship loyalty test that I do from time. Hello. Hey cop, can you pick me up from Pillbox and take me to PT to be on duty? Thing is, I just got.
Yeah, do you want us to like head up that way a little bit? Yeah, if you want
Okay.
to stay like the
Alright. Broke my heart.
back on this radio and tell you when it's
Yeah, he's busy.
Okay, 10-4.
No, it's fine. I'll wait for him. I'm not gonna drive myself.
Well, that sounds good. Why don't you grab your shirt and you can hang out up front in the lobby, because the radio just got real busy, so I'm thinking I'm fixing to have a whole bunch of cops running around up here.
There's a 99 situation. The officers are gonna get gunned down.
Oh, hell. I guess I better go get the trauma beds ready.
Oh, you.
Joys of being the trauma surgeon.
It must be pretty fun being a trauma sergeant with all these new gangs running around town.
It's been pretty slow for me here lately, but it usually changes in about a moment's notice. I'm hoping, actually, that maybe the next round of medical students I can pick up a resident.
That'll be super helpful.
Hey.
He knows what he's doing. So, when I was down here, shard on my neck. I had to wait for 2 hours.
Yeah, I'd really like to get a resident to train in trauma surgery, and that way there'd be more to do it than just me. It's a lot more in depth than general surgery.
That'd be fun. I love standing like this, like an old man. Just a little older, just a little wiser.
Hey,
Still the king of fuck ups.
as long as it makes you comfortable, I don't think you can ask for any more than that.
Yep, I think 2 of your paramedics went out to the scene to pick up the officers.
Well, I'm gonna go get my trauma beds prepped up, but like I said, if you have any trouble or anything, you've got my number, just call me.
Alright, sounds good, perfect.
And for some reason I can't answer, I always respond to messages, so I may be tied up in surgery or something, but as soon as I get done, I'll reach back out.
Alright, beautiful. Thank you so much.
You are very welcome. You be careful now.
Alright.
I'll see you later. Howdy. And let me knock out these real quick before I forget. There goes the ambulance. Band-aids and poo-poo buses.
Unity M.
Send it.
We have multiple suspects and one officer down here across the street from the Vinewood Theater.
Ooh.
Okay, is it clear to come there? We were told to be on standby and that.
Yeah, it's clear. It's code 4 now, so you guys are clear to roll up now.
Okay, 10-4, it'll be 10-76.
Send you a.
Swelling. And on prior exam. That sounded painful. myself for 2 idiots. So, good Lord.
The 501 direct.
Go ahead.
We have one or two 14s with multiple 15s down. At least one is unresponsive. I think that we might have more than one that's unresponsive. They're all gunshot wound victims.
TN4. You need additional transports.
I think we can get them all transported, but I'm not sure if there might be additional care that's needed.
TN4. I'm prepped and ready for them in the ER. We'll get them sorted when they get here.
Okay, 10-4.
Ooh, mass casualty. Here we go. Ready to do some work.
I could be, however, I'm in phase 2.
Well, you're gonna have to be a real good extra set of hands, because we've got a mass casualty coming in. So, they're fixing to bring in, probably about 10, 12 patients from a gunfight. Looks like we've got multiple unconscious unresponsive, so this could get real hairy real quick.
Good first day on the job, let's go.
Hell yeah. And since it's your first day, what's your name, son?
My name is Isha.
Isha, it's nice to meet you. I'm Dr. Knight. I'm the trauma surgeon.
Nice to meet you, sir.
And make sure you got clean gloves, and looks like our party's getting started.
Oh, I see.
Wait, good luck, soldiers. I'm here to encourage him on his first day in the job, and you put him in.
Well, put it this way, I got my medical license through the Army Medical Corps.
Radio, I'll tell you that, Jesus.
Okay.
Is this my first batch of patients?
Sorry, say again?
What the fuck?
Is this my first batch of patients, or y'all just stopping by?
I'm sorry.
Aroused. We're just stopping by. I'm not a patient.
I'm sorry. He's my suspect. I got him.
Okay, I got you. I'm waiting on several, so I appreciate it.
Appreciate you. We're definitely
Better clock in, bro.
I don't know how.
Oh, come here. Right here, you can clock in.
Nice.
Gotta at least get you paid for this.
Everybody remain calm. This is a drive-by serenade.
A drive-by serenade, huh?
I'm so excited.
It's a drive-by serenade. Put your hands up.
Yep, it's fixing to get real chaotic in here, ladies. We've got multiple patients inbound.
She's just a girl and she's on fire. Hotter than a fantasy. Lonely like a highway. She's living in a world and she's on fire. Filled with catastrophe. She knows she will find a way. Oh, she got both feet on the ground and she's burning it down. Whoa, she got her head in the clouds and she's not backing down.
Say again.
But we're going to be
This
going
girl
to
is on
St.
fire. This
10-4.
girl is on fire.
We'll head over towards there.
She's walking on fire.
Alright, they're gonna take all the patients over to St. F. Let's load up.
Is on fire.
What'd you say? Where is it?
They're taking all the patients to St. F. Right this way. Alright. Oh hell, I forgot to move the damn. There it is.
601 is going to be connecting to St. F with 114.
There we go. Maybe. There it is. Yeah. I ain't driven in a long damn time.
Don't check the suspects in until we have officially cleared this entire area.
Yeah, 10-4. We'll just be waiting at the front door.
10-4. I don't want y'all to check in and get hurt or anything.
I ain't drove in a long time. You might want your seatbelt on.
I got it on, brother.
Ooh, my eyeballs. Alright, let's get inside and see what we can help with. How the heck are my eyeballs going haywire? There we go.
Good, you guys okay? Go get treated
So far.
Alright, what are we looking at?
Well, she was, they were all involved in a shootout. She was unconscious. She's got a light pulse now. Everything's all packed up. She definitely, you know, took a, not a very good, she took a few gunshots, sorry.
You can check this lady in.
Okay, we can move her to get checked in.
Alright.
You want to move her or you want me to?
Oh, go ahead. I was just checking her wounds real quick. Let's get her inside and get her on a bed.
Hudson.
God, I ain't been over here in a long time. Alright, all patients will come back.
Turtleneck to tie. Non-turtleneck.
Alright, be on standby with fresh bandages and IV materials.
And then try and slip into the shirt.
Hey, so that whole thing about desk duty, yeah.
Alright, let's see what we got here. Oh. Let me trade with you,
I
David.
had to go like this, you know? Aim.
Yeah, you just did a lot of that, so.
Y'all wanna, Doc, you wanna check on her and see if we can?
Alright, y'all ready? Ma'am, can you hear me? Easy there, ma'am. Let's start tonight. Can you talk to me? Bright light in your eyes here. There we go. Can you tell me your name, ma'am?
We'll submit it.
No. Where are you hurting at?
I feel massively threatened when people just do that.
Bricked up wearing that jacket
Oop.
and turtleneck.
Oops.
Alright, let me get this one moved down to another room.
Get a tattoo on your stomach.
Sounds good.
Alright, man, with that awesome hat. When you get out of the bed, just face the purple wall for me, okay? Just maneuver around the woman.
Incident has been submitted.
Alright, man.
Go ahead and get him secured.
What am I
Did you
watching?
kill Cruz? Did you kill Cruz?
I don't
You guys
know,
killed
sir.
Cruz!
Sir, calm
You guys
down.
killed Cruz!
Sir, calm down.
Alright, ma'am. Let me get you down to another room.
It was Cruz. The woman, I'm assuming. Sir, she is in the best of care. Batman is with her.
Me firing a gun.
Deputies, can I get one to escort?
Yeah, what's up?
Hello, sir.
I'm gonna move it down to a different room.
Nah.
That was dumb.
I wouldn't do that unless you ran again. Oh my god.
Reverse
This
tackle.
Jesus Christ, mate. Let's go. Let's go, awesome hat man.
Apple, did you just go Australian for no reason?
No.
Alright.
Go ahead and check that.
My eyes are a little scuffed there. Let me help her get on that bed right there. Alright, now let's see if we can work on you a little bit. Alright, man, tell me where you're hurting at. Yeah, everybody calls me Batman. Oh hell, it's Miller. Everybody run. And Miller, it's not Dr. Silo. This is Shilan. Ma'am, can you hear me? There you are. I'm gonna start checking these gunshot wounds. Tell me where you're hurting at.
Look, man, if I step out that building and I get a bullet in my head, I'm gonna cry.
Bro, there's so many of y'all there. What the fuck is happening?
Miller, don't make me smack you upside the head now. Do-doom-tsh. Alright, you're gonna feel lots of pressure here. I'll start burning these wounds closed.
Where's the doctor?
Oh, 10-4.
Right. Oh, I need an extra set of hands in here.
I'll send it over.
Skyrock look like?
I appreciate it. She's got multiple GSWs. She keeps trying to talk, but I just need an extra set of hands, and I can get some medications going.
Yep, just let me know what you'd like me to do.
Awesome. Can you hang 2 bags of lactated ringers, 1,000 milliliters apiece, please? She's got at least 1 large bore IV, but this bag's about done.
Yep, no problem. Take care of everything else. There you go.
Thank you. Let's see if we can get some fresh vital signs here. There we go. Looks like her pulse was stabilizing.
Came back.
You go ahead and pop me open another suture kit with some 5-0 Vicryl, please. If we can get all these closed up, we can get her stabilized.
I have this open for you, and there's your good supplies here as well.
Awesome, thank you. You feel comfortable mixing up medications?
I mean, I haven't before.
In the cabinet on the far right, there should be a vial of powdered Bactrim.
Okay.
Grab that and mix it into 500 milliliters of normal saline in an IV bag.
Okay, this cabinet here?
Yes. And just make sure to shake it up till all the powder's dissolved.
Got it.
Get her some antibiotics on board. And bless, I don't think it's shot with. This is a fairly large one. Just see if we can get the bleeding under control. I guess she's never actually got to have a surgeon before. Hey, that's okay. Everybody's got to learn.
I don't see any powder left in here.
Excellent, that looks good. Will you tie that into a piggyback off one of those bags of LR? Should be some short tubing in that big storage cabinet. Alright, I think we got the bleeding under control now. Right. I'm not seeing anything else. Do we have any idea what this young lady's name is?
I'm not sure. I can check for identification on her, possibly.
If you wouldn't mind. Yeah, at least write up some notes. She's got a lot of bullet holes that I had to stitch up. I don't want her to have any post-operative complications. need some time to rest and recuperate, and it's going to take that Bactrim a little bit of time to get into her system.
How do I these?
Go out that door. I'll wait you.
What's going on here, anyways?
Yeah, none of your business.
Wait a minute. What's it?
Leave the area. Sir, you're asked to leave the area. Just leave. It's not that hard.
There we go. Awesome, I appreciate you doing that. All right. There we go. All right, she's at least stable for the moment. We'll probably need to transport her back to Pillbox and put her in the ICU there.
Okay.
She definitely ain't gonna be able to run or anything like that.
I just flipped that ID over. It looks like there's one emergency contact. I'll take note of this as well real quick.
Excellent. If you'll just write all that down for me, I'll get all the chart notes updated. I know there's more patients waiting. And I stole y'all's EMT student.
I'm sorry, what'd you say?
I said I did steal y'all's EMT student. That's why he's over here.
I mean, I'm not even in FDP. I'm not sure.
Yeah, he's gonna get trained like a doctor today, because I'll definitely need the help. I gotta keep y'all free for calls.
Yeah, no worries. Alright, I'll get her transferred to Pillbox here.
Awesome, and if you just let me know what room you end up putting her into.
Okay.
And probably just to make life easy, here's my card. You can just holler at me or shoot me a text message and I'll pull everything out of my phone later.
Okay, got it.
Awesome. I appreciate it. I'm gonna go see what else we got. Hey, Deputy.
How you doing?
Not too bad. This one's gonna have to go back over to the ICU at Pillbox. You're gonna get her prepped and ready to transport.
10-4.
I think we at least got a name on her.
Okay, perfect. I'll just
Yeah,
get a
I can
fingerprint
give
to
that
double
to
check
you.
and then.
Okay. And would y'all possibly have enough personnel that somebody could escort my paramedics?
Yeah, we'll escort them.
Awesome. I just want to make sure my people get there safely.
Is there another one too? Another surgery, or are you good?
I haven't been told about another one, but we gotta go check.
Let me get a fingerprint.
I think everybody else is good.
Okay.
Okay. Yeah.
I think so. I thought I saw them all go out there and get into the car.
That works. All right, you got a car, Cobb?
I do.
We're gonna escort you to.
All right. Let's go make sure there ain't nobody else.
She's going to ICU.
No, she's not going.
Don't trip on them. Oh yeah.
Yeah, thankfully that didn't get as chaotic as I was expecting. Alright, all the beds in.
Since she's being arrested, they're gonna have to take her up to the Bolingbrook ICU.
Oh, that's fine.
Up at the prison.
Yeah.
Just figured I'd send that information along.
I appreciate it. Yeah, they've changed a lot of procedures while I was gone, so.
Yeah, once they Well, you know, anytime they're involved in something criminal like that, they have to ICU. They got to go up there to Bowenbrook.
They at least get that damn place restocked. Last time I was up there, it was barren shells and expired crap.
I'm sure it's probably not the best.
Man, I don't even expect the best. Hell, I've spent months in Africa and basically huts doing medicine, but yeah, I gotta at least have the supplies to work.
Yeah, that's true.
So
Alright.
since she is 15, she has to go to the ICU on surgery.
Take a right, and then
Oh, that's no problem. We can arrange for treatment up there.
Alrighty.
You ready?
Yep. Whenever you're ready, we'll move out.
Yep.
Alright, we're ready to start transporting up to the prison.
Alright. Yep, I think we're gonna get our happy asses back to Pillbox.
Yep.
Saying it's nice, but I like Pillbox. Yeah, that was a really crappy parking job I did.
Are you guys EMS?
That we are. What can I help you with?
Where'd that ambulance go that just left?
They were headed back towards the main hospital, I believe.
Fuck, okay.
Nice. That was nice.
Yep. We're going to take the back road.
What's up?
Said we're going to take the back road.
Yeah, probably a good idea.
.501 to 601 direct. Just a heads up, we had a black two-door sports car. Just asked where that ambulance was going. Told them we believed it was going to the main hospital, but they may come behind y'all. You might notify PD.
So was there like a...
Yeah, black Corvette looking car.
There's also a silver Evo that started tailing.
Okay, 10-4, thanks.
The light is green, local. Really wonder what in the hell started a damn gunfight with that many people getting hurt. It's just ridiculous.
Where did you hear the, like the 10 to 12?
It was just the original projection they gave us.
Oh, okay.
Normally, PD tries to give us a ballpark estimate. And since we won't need this again, I'm gonna go ahead and go park it. I like the fact they've added RPMs. That's kind of nice.
What's up? How's it going?
What the fuck?
EMS.
What's up?
What's up? What's up? We doing this thing right now or what? Flash some lights, bro. Flash some lights. What we doing right now?
I'm too old to be racing. Oh, that.
What in the world is
The
happening?
hell?
My engine don't work.
Oh hell, my eyeballs are acting up again, damn it.
Yeah, I feel that.
Oh, what in the world? Yeah, I gotta get us back nice and easy. Hold on. As long as my head don't pop, I'll be happy. Oh, there we go.
Chirp.
Oh, hell. There we go. Yeah, I'm normally not the one that would be teaching you things like that.
Yeah, no. I know. It's just a ask out.
Alright. But the garage is right here. That's where you can pick up your ambulances when you come on shift. And then always make sure that door is locked, because this one and the one down on the other side there are unlocked so people can come into the hospital. Alright.
602, something 76 for the latest.
Let's see here. You said this is what, day 2 for you?
Oh my god. I had my interview.
It hurts.
And waiting on the rest today.
Nice.
Or interview and test yesterday. And the rest today.
Oh. On my knees.
Yeah, they got you in uniform, so that tells me at least you passed your test and everything.
Yes, sir.
Yeah. Normally I don't do any of the field work. I mean, if they need a surgeon in the field, I'll go, but I tend to stay away from the ambulances. I'm getting a little too old for that.
I mean, you saved that lady's life, probably.
Yeah, she's at least stable for the moment. Multiple gunshot wounds, high risk of infection. Yeah. Yeah. No.
It wasn't 10 to 12.
Yeah. So just a word to the wise on anytime you potentially got a mass casualty. get more resources than what you think you'll need, because you'll probably end up needing more than what you actually get.
Yeah, that's a good
But always remember, 10-4. But always remember, in a mass casualty, we can't pick and choose. We look at the patients, we assess them. Whoever's got the most critical injuries goes into surgery first. Everybody else, we do treatment to stabilize until we can get them into the operating room.
I have a little bit of medical experience, but I can't. Triage, that's what it's called.
Yeah, I'm about to say, if you ever took like a first aid class, anything like that, I bet they taught you just the basics of triage. Always grab the sickest one first, and you can go from there.
Also was Army medic for about 8 years.
Oh, hot damn, a fellow soldier. Man, I started off enlisted and right out of school, so I started off as a combat medic. You get a hell of a lot of good experience there.
A lot of fun, honestly.
Yes, sir.
Even if it's just giving your drunk buddies FEs.
And you know, if you ever went into combat, you learn how to fix really, pardon my French, fucked up problems with bare minimal supplies.
Yeah, for sure. Only seen action on the border, that's it.
Nice.
It's a little unfortunate.
Yeah.
It's pretty, again, pardon my French, a little fucked up down there too.
Oh yeah, there's some real screwed up shit down that way. I saw combat in Afghanistan and Iraq. I was in Iraq, I was at the field hospital most of the time, and yeah, I was usually the one the damn colonel was pissed off at because I wouldn't evac when they told me to. But
Just a tough bastard.
602 is going to be 1019 to St. F, 147.
time for. Yeah, just stubborn. I figure when it's my time to die, ain't nothing me, you, or anybody else can do about it. I'm just gonna keep my fingers crossed it's quick.
I'm sure it's the same over there where the border sucks because you never know who's good and who's not.
Yeah.
It's the same over there.
Yeah, I mean, honestly, there's a lot of genuinely good people that really were just needing medical help. We'd help them out, get them patched up to where at least the locals could take care of them, and we'd get them all on their way to the local hospital. But we could only treat civilians that were casualties of our presence.
Our problems,
You know, if it was just a sick person or something like that, they got pissed if we tried to help them. But
Her business card that I found?
if you would, that would be perfect.
Okay.
Yeah, that's. Oh no, you're good. We're just reminiscing about old army days.
chopping up the war stories.
Yeah, you know, I kind of looked at. I was usually on the night shift, so didn't have to mess with the colonel too much.
Oh, that's perfect.
602 is going to be 1019 to Pillbox.
Time for. The hell that our rule was what colonel didn't know didn't hurt us.
Night shift's the best time, man. You don't have much supervision.
So the lady you brought up to Boilerbrook has woke up and is now talking. So we're just gonna continue to process her. So I don't think you can develop the IC paperwork. Does that make sense?
Okay.
Yeah, that's fine.
Yeah, I'll still put a sheet in just in case she has any post-operative issues.
Yeah, well, a surgery report at least, I guess, right?
Yeah, 'cause that was still a lot of cauterizing and a hell of a lot of stitches.
Yeah, okay, let me finish sending this to you.
Yeah, has anybody seen or heard from Roy?
Roy?
Cowboy Roy?
No, not in a while.
I was hoping he would have checked in with me by now. I let him go home a few days ago.
Hello, hello. Hello.
Hello.
Hi. Hi. I need healing. My arm is injured.
Yeah, you
No.
can go ahead.
Yeah.
There's like a sign-in sheet over here.
Okay. Yes.
That one's got a really big head.
Oh, well, thanks. Yeah, I'm with them.
Okay.
Oh, hell. I'm trying to think who in FTP would normally be around this time.
Yeah, I have no idea.
Thank you.
Yeah, no problem.
Sir.
Man,
I mean, Sophie's usually like crackhead hours.
that's true. I wonder where she's at.
Some people just work nights, you know.
Oh, yeah, I like the night shift.
I mean, sometimes Sky is. I don't know if she's still in FTP or not.
Dang, I haven't got to talk to Sky in quite a long time.
Yeah, me either.
I do miss her. You know, and actually, hell, who wants coffee?
Good, thank you, though.
It's in a straight line faster than my Lamborghini. And he does not want to let it down. There you go.
Thank you.
Evening EMS. How the fuck are we doing? What the fuck?
How were you, sir?
Oh my fucking god, why do you make me nuts tingle? Do it again.
And unfortunately, when you get a voice this deep, it just has strange effects on people sometimes.
Yeah. Fucking have to get me one of them voice boxes. God fucking damn it. Look at me, Gotham, what the fuck? Get the fuck out of here. You, oh my fuck, I definitely feel like I'm in fucking Gotham now.
Well, that was definitely a new one. Oh hell, I know what I hadn't done today that I need to.
Okay.
Hey, 100 a day keeps the surgeon away. He'll throw you back out doing those with that bag on.
True.
Damn, it's time. Fixing to be 11 o'clock. Good
Is
lord.
Roy the guy that was there, the guy in the red shirt? Or
Nah, Roy's one of our paramedics, but he got attacked or something a few days ago. I ended up getting a page when he was brought into the hospital. You'll like old Roy when you meet him. He's a hell of a guy to be around. Oh yeah, I'm trying to make everybody yawn. This fixing to be bedtime. Who? I best put my shirt back on for if somebody shows up. I don't want to scare somebody away.
the voice and the rib muscles.
I wish they were ripped muscles. They used to be a hell of a lot better. Oh, I wonder if that's going to be our next patient coming in. Eee. Handing out participation trophies for crimes went down. That's fucked up. I love it. I'm thinking things are looking pretty good. I think I'm gonna go get me some sleep.
Sounds good.
Y'all try to stay out of trouble tonight.
Yeah, thanks.
I should be around tomorrow if y'all need me.
Okay, yeah, thank you.
See
Appreciate
y'all
the help.
later. Anytime. Hey. Oh, there you are. Oh, you're good. I gotta go get some sleep, so just hang loose and hopefully somebody from FTP will show up. But like I said, I don't know who works these late hours. I haven't been in an FTP in a long time.
Are you tagged or no?
Do I?
Taxable or no?
Nope, I'm not TECC. Probably should be, but eh.
Seems like your area of expertise.
I'm rather good with bullet holes, but you know, tech tends to run around in some rather dangerous situations. I don't think they want their trauma surgeon doing that. But hey, might be something for you to look at, especially that combat medic experience. You could be quite useful.
Only if there was a sweet, sweet doctor to rate me.
Oh, what was that?
Yeah, it's a 14.
Oh, I was like, what is that? I just heard somebody talking.
Infected. He got some flashlight therapy, I guess.
Ow. Yeah. Well, y'all have a good night. I'm gonna go get some sleep. Oh well. All right, y'all. Well, I'm gonna call it a night right there. I need to go get some sleep. I gotta get up early in the morning, so gotta be somewhat rested. But as always, y'all be safe. I'll catch you on the next one.